Hello, Dr. Chris Beto, Dr. Physical Therapy here, wanting to talk about your ProStretch Z. You may be asking yourself, I got it, I received it, now how do I address my specific impairment, my specific pain with using this really unique and cool device? So those of you with left-sided low back pain, I want to talk to you right now. So if you're experiencing left-sided low back pain, chances are that left side of the innominate of the pelvis has rotated posteriorly. And we just want to double check to make sure that that is correct. An easy way to check that is to look at your leg length discrepancy. Looking at your legs, you can tell if one leg is shorter than the other. So with left-sided low back pain, we're going to assume that the left leg is shorter than the right leg. Now, if that's the case, we want to address that specific problem to realign that side of the pelvis. So we want to lay down on your back, we want to bring the legs up, and we want to position the ProStretch Z with the pads being over the left leg and under the right leg. We want to grab on with both hands. We're going to bring the legs up into 90 degrees. And now you're going to be pulling with 80 to 90% max effort up with your left leg, down with your right leg. So we're contracting the hip flexors on our left side that's able to try and shorten that muscle and rotate that innominate forward. And we're doing the opposite on the right leg. We're able to contract the hamstrings and the hip extensor muscles, creating that other rotation opposite of the left. We're gonna do it for 5 seconds. We're gonna reset. Take a minute if you need to, take a few seconds, or you can go right back into doing it again. We're gonna hold it for 5 seconds. Make sure that you're breathing through the whole movement. We don't want you to hold your breath. We want you to keep breathing, 80 to 90% max effort, back down. We're gonna repeat this 2 more times for a total of 5 repetitions for this one set. After that 4th repetition, if we did have an effective change in the malalignment of the pelvis back into alignment, things that you might be experiencing, you might have heard a pop, that's okay. You may even experience a little bit of groin pain. There is another joint in the front next to your groin called the pubic symphysis. And sometimes that pubic symphysis can also move. So if you're experiencing that, that's okay. But we want to reset the pelvis by doing a nice adductor set. We're going to squeeze for 5 seconds. We're going to relax, and then we're going to do a bridge up and back down. That's going to help to just reset the pelvis. And if you're still feeling that pain, you can do this over and over again. If you're feeling muscular fatigue, take some time, take a day, do it the next day. Doing this over the course of 1 to 2 weeks, you're going to experience that reduction in the pain that you have on the left side of your body, realigning the pelvis and creating that proper mobility and alignment. And for more information, go to medi-dyne.com.